The next element is indication for surgery. Indication for surgery when you have a fracture. So now, generally, surgeries are indicated when you have 6 major points. The first point is if you have a patient that has an infection of the bone or risk of infection. Is it clear? If there is risk of infection or there is infection of the bone, it's an indication for surgery. The second element for surgery is when you have a known union. Is it clear? Known union / malunion is also another indication for surgery. Is it clear? Known union / malunion is an indication for surgery. The third indication, generally fractures associated with intra-articular fractures. Is it clear? Intra-articular fracture, a fracture associated with articular site. Is it clear? Generally, there are indications for surgery. The fourth element, after fractures with intra-articular site, fracture associated with the articular site, we have the next element, intra-articular fracture. If you have displaced fractures, fracture that is having high displacement, is it clear? Displaced fractures, is it clear? Generally good for surgery. The fifth one, after fracture with displaced fragments. So when you have displaced fracture, you have also unstable fracture. Unstable fracture is one that is an unstable fracture is one that is not displaced, but when the limb is mobilized, it's getting easily displaced. That is the definition of an unstable fracture. An unstable fracture is one that is not displaced, but when the limb is mobilized, it easily gets displaced. Are you getting? So those are the 5 major indications for surgery. Anything apart from that, you can do a close reduction and you can do a close restriction. Is it clear? You can do an external restriction with a cast. Apart, if you are not inside these 5 elements, you can now do a cast. Is it clear? You can place a cast, those casts that we put on the limbs and all that. Is it clear? If you are not among these 5 elements, you can either place a cast or you can place also a sling or a splint. Is it clear? So the cast is another one method of restriction. External restriction is a cast, which is plaster of Paris or fiberglass. You can have also a sling, or you have what is called a splint. Is it clear? So you can use this provided you are not falling into these 5 categories. If you have a fracture not falling into these 5 categories, generally we use these elements as external restriction methods. But now, if you have a fracture falling in these 5 categories, particularly these 2, when you have infection and known union, it is indication for internal fixation. Is it clear? When you have these 2, is it clear? When you have infection and a known union malunion, it is mostly indication for external fixation. Is it clear? You use an external fixator. External fixation is different from external restriction. Is it clear? External restriction is just is a method of doing a restriction externally, but fixation is by use of external fixators. Is it clear? The use of external fixators. So when you have external fixation, it is mostly indicated for case of infection or risk of infection and non-union malunion. Is it clear? Why? Because like in this case that I've explained here, let's say that the fracture site is located here. When you place an external fixator, you see that the pins are away from the fracture site, so they are not going to conceal the infection, is it clear, at the level of the bone. But just imagine that you use a plate. Is it clear? This is a plate like that with screws here and screws here, or you use an intra screw. Is it clear? Screw that is connecting the both fibers together, or use an intramedullary nail. Is it clear? When you use those internal fixator method, it's going to conceal the infection here. Is it clear? And you need to know that infections of the bones are not easily treated. Why? Because the bones are not highly perfused. The bones, though there is a high surface area of the bones all through the body, the bone only receives 5 to 10% of the blood supply. Is it clear? And you need to know that at the level of the diaphysis of the bones, the bones receive its blood via diffusion from the periosteum. Is it clear? Receive blood via diffusion from the periosteum. It means that that compact diaphysis is not really perfused with bone. It is only the epiphysis that is perfused with bone. So giving antibiotics is of no need. Is it clear? When you have a high infection already of a bone, Are you getting what I'm saying? So those are the different elements that you have to understand when you have bony infection. In children, when you have osteomyelitis in children, it is good because children, the bones of children is highly perfused with blood. But when it's already in adults, when you have infection of the bone, it becomes more difficult. Now, after the diffusion, that's why you need to do an external fixator when you have infection or risk of infection in order to remove the site where there is infection, and then you place the pins further away from the site of the infection to prevent the conceal of the bacteria, to prevent the bacteria to be concealed at that location. Also, non-union and malunion still use external fixators for the management. Now, in the case of intra-articular fracture, in case of displaced fracture, in case of unstable fractures, we now use what is called internal fixation methods. Now is where you can now use your screws, you can use your plate internally. Is it clear? And other indications, the sixth indication for surgery is for cosmetic reasons. Some people don't want to move, though they are not falling into this category. They don't want to move the cast, they don't want to move the sling, they want to move the splint. Is it clear? They just want to place an internal fixator. So for cosmetic reasons, you can also operate the patient. The patient will. And then the seventh reason, you have neurovascular damage. Every time that you have neurovascular damage, you need to operate that patient. Is it clear? So those are the different elements that you have to do. And when you are operating the patient, your main target is to do a primary nerve repair or a primary vascular repair. Now, the next point after this is a follow-up, so the rehabilitation. Now, for rehabilitation, you need to know that it is actually physiotherapy.